Hello everybody, my name is Francisco Perez and I will be presenting on 2021 International Web-Based Neurosurgery Congress the poster called Endovascular Coiling of Right Vertebral Artery, Saccular Aneurysms at Not-Branching Site, a potential and safe treatment option. Well, the reasons I decided to make this e-poster are the following. As we know, saccular aneurysms and not-branching site of the vertebral artery are a relative rare disease, accounting approximately 5% of all intracranial aneurysms. As endovascular therapy has evolved over the past decade, it has become increasingly popular for the treatment of posterior circulation aneurysms. Endovascular therapy diminishes the higher morbidity and mortality rates linked to the complex surgical approach to the posterior fossa. Patients with ruptured vertebral saccular aneurysms with a poor neurological condition may benefit from endovascular therapy. This is a woman in her 50s with a history of uncontrolled high blood pressure came to the emergency department with a thunder headache. She had a score of 6 in the Glasgow scale, and therefore she was transferred to our institution. Non-contrast CT revealed CAH with intraventricular hemorrhage and brain swelling, Fisher 4. The angiography revealed a small saccular aneurysm in the right vertebral artery proximal to the posterior inferior cerebral artery. This is the non-CT scan and on admission axial plane, evidence of CAH in the right sylvian cister, peduncular cister, and foreventricle, and at level of posterior fossa, the CAH with extension of posterior lateral fissure. Cerebral angiography, lateral plane, it shows saccular aneurysms of right before artery inferior to the posterior inferior cerebral artery. Under general anesthesia, a right transfemoral arterial access was obtained, an insulin microcatheter was advanced into the aneurysms. For action detachable coils were used, repetitive injection of the arterial contrast agents were performed to evaluate the obliteration of the aneurysms. There were no complications related to the procedure. So, vertebral aneurysms comprise approximately 1/3 of posterior circulation aneurysms and 5% of all intracranial aneurysms. According to their morphology, these aneurysms can be classified as saccular and dissecting aneurysms with a 78%. Saccular aneurysms can be subclassified based on their geometry as follows: those associated with a side branch, those occurring at a bifurcation, and those not associated with a branch vessel. Aneurysms situated at not-branching sites are infrequently, but seems to be the most favorable for endovascular treatment. To our knowledge, this is the first case of endovascular treated before aneurysms reported in our region and demonstrates a successful case of coil embolization, achieving excellent patient recovery. Thank you.